Physician burnout is common across medical disciplines, largely due to the unrealistic demands of the healthcare industry. However, even as we work to fix the system, we have to recognize that being a healthcare provider is inherently challenging and emotionally impactful. In this paper, we describe a model that integrates resiliency skills into career-long medical education. My name is Matthew Cordova. I'm an associate professor at Palo Alto University and a staff psychologist at the VA in Northern California.
And I'm Christoph Gimler. I'm a clinical assistant professor of medicine at Stanford and an internist at VA Palo Alto. I also work as a licensed psychotherapist, and I specialize in healthcare professionals. Our paper with Dr. Lars Osterberg is entitled Foster Well-Being Throughout the Career Trajectory, a Developmental Model of Physician Resilience Training, and it's being published in Mayo Clinic Proceedings. So Matt, the first part of this paper describes burnout and why resiliency training is so important. What are the key takeaways in your mind?
Well, many physicians have been socialized to view their own emotional reactions as pathological, the result of something gone wrong. But emotional reactions to caring for patients who suffer and to working in this demanding occupation are normal and unavoidable. Medical school, postgraduate clinical training, and continuing education give doctors the knowledge and skills to assess and treat patients and to work in healthcare teams. But doctors don't receive training in the emotional, social, and system skills needed to maintain their personal well-being through their careers. While efforts are being made to change the culture and industry of medicine to prioritize physician well-being, we also need a career-long model of education and support targeting physician resiliency. Now, Christoph, what do you see as the key components of this model?
So this model focuses on the progressive nature of resiliency skills, and it leverages the stages of medical training to introduce these skills at appropriate times. So our model starts with preclinical medical school with what we call foundational skills, things like cognitive framing, mindfulness, which set the stage for future skills building. As students enter clinical rotations, intrapersonal skills dealing mainly with emotion regulation and stress management are introduced. When residency begins, we focus on conflict management and de-escalation to support residents through this really intensely relational stage of training. Later, we present content aimed at running groups, leading teams, and then finally navigating organizational culture. And you can get the sense how these skills build upon each other progressively as we develop in our jobs as physicians. And I think it's really important to underscore here the longitudinal emphasis on diversity and inclusivity really throughout the curriculum.
So as a physician and as a therapist, you've been teaching these skills to docs in training and those well into their careers. How does it play out?
Yeah, so I'll give you a concrete example, Matt. Let's say we have a physician presenting into years of increasing burnout, describing overwhelm with work duties, anxiety with demanding patients, and frustration with difficult colleagues. So this person might benefit from mindfulness skills, maybe meditation practice, to increase her awareness of these emotions as they arise. Next, she can learn to recognize maybe that when there's conflict, she tends to automatically acquiesce, causing anger to build up inside. So recognizing these emotional episodes and the patterned reactions, she can learn to manage conflict more intentionally through approaches like boundary setting, or negotiation skills, for example. So just as with other areas of medical education, the sequence in which the knowledge and skills are taught is really key. We find that when people's emotions and reactions are approached through this framework and normalized, they experience less shame, less stigma, and feel more effective handling these issues because they have frameworks and tools to bring to bear. So Matt, where do you think we go from here?
Well, to improve and maintain physician wellness, we need quantum change, both in the healthcare system and in the approach to career-long education. A developmental, integrated model of physician wellness is just what the doctor ordered. We hope you'll read our paper to learn more about this approach.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.